I guess my question for you both as healthcare leaders is what are some of the unique challenges that you see facing the Coachella Valley, particularly around the intersection of access to healthcare and housing instability?
As the cost of living goes up and up, access to housing becomes a greater challenge.
Hmm.
And that is why I am so grateful and Desert Care Network's gift is so important to our Vision Forward campaign because if we don't include access to housing as part of addressing social determinants of health, we will never achieve the health outcomes for everybody in our community that you and I so badly want to.
Yes, totally agree with what you're saying because recidivism, from what we see on the hospital side, that is just a huge issue. And what you're doing here in expanding access to primary care and what you're doing to provide housing and the wraparound services you're providing in that housing to actually help people be successful and to be able to return to the workplace if that's what they choose, to work with you to transition to more permanent housing. Saying, if each of us focus on our strengths, your strength in the outpatient arena and the ambulatory market is far exceeds what we're capable of doing, but we have strengths in taking care of people in an emergency situation when they require inpatient care. But it really takes both sides to accomplish that goal and objective of improving the health of everyone within the Coachella Valley.
So beyond physical well-being, primary care, dental care, and other services that a resident may need, can you talk a little bit about maybe somebody who might be experiencing addiction or somebody who may be having a mental health challenge? What other services are going to be available to them within just steps of their new home?
Over DAP's 4 decades of service, we have learned where you get the best return. For chronic pain, sometimes it's acupuncture and
Mhm.
sometimes it's meditation, right? For enhancing the immune system, sometimes it's dentistry work combined with nutritious food. Today, in 2024, we provide those wraparound services to all people that we care for here at our Sunrise campus in Palm Springs. We know when people are facing obstacles to good health outcomes, that sometimes it is more than pharmacy, more than
Mhm.
physician. It is a holistic approach.
A good part of what we're looking forward to with this particular project and the continued expansion of that holistic approach is that it will reduce significantly the amount of times that an individual will return to an emergency room because they aren't receiving that holistic approach. And so we do see that the emergency room usage and the accessing to emergent or urgent care actually reduces when the programs are in place to provide that holistic approach.
Talk to me a little bit about the case management that's going to be available and how that integrated approach is going to help empower those residents access, specifically what they'll be able to access on the campus at DAP Health.
So for the residents at Vista Sunrise II, they'll have a housed case manager on site each day, which will help them build care plans. So whether they're in chronic pain and they need to access the acupuncturist and the
Mhm.
chiropractor, or they're in need of job training and access to food, that they'll have a professional from DAP Health staff who will be there to help them create that plan, provide access to that care, and then to follow up to make sure that the referral was successful and that the service was received.
So Desert Care Network was very excited when we had a conversation with David and with DAP about their vision to expand with Vista Sunrise II. We see daily the impact of the unhoused and the underserved in this community. We see it in our emergency room when people cannot access care, and then we also see it on our inpatient side when we can't discharge individuals because there's really no safe continuity of care out in the street. We don't know what the future is going to hold, but we know that there's going to be challenges in that future. Whatever it is we face, I believe in the core of my heart that we're going to step up to each of our best ability and do what's right for this community. And it's not only our mission, it's our obligation.